My name is Steve Arndt. I work at Southeast Orthopedic Specialists, and I focus on the lower extremity and foot and ankle orthopedics. I joke with my patients that there's really no problem in the foot and ankle that I won't see them for. Could be bunions, ankle arthritis, fractures, tendon injuries. Care does not always mean surgery. Care, in fact, in my hands, rarely means surgery. I would say most of the time I'm managing non-surgically. There's a lot of great tools in the foot and ankle, whether it's orthotics, physical therapy, bracing, anti-inflammatories that really can provide a very suitable solution for a problem. And when patients have a bad problem and their life is really impacted, and you can positively impact that, whether it's in the operating room, whether it's in the clinic, and make a difference, improve their quality of life, improve the time they have with their family, or even the time to do the activities they want to do. That's really the most important and rewarding parts to me.